اليوم راح نبدي بالنيو lecture which is about impression material. شنو impression material؟ شنو مواصفاتها؟ شنو classification؟ advantage, disadvantage in detail. First of all, we'll talk about some definition, some terms of impression. Okay. Impression material usually used to obtain impressions of the teeth and or surrounding oral tissue. معناتها both of them. هم teeth, هم surrounding oral tissue. What do you mean by surrounding oral tissue? It means soft tissue, sometimes residual ridge, sometimes palate, sometimes internal borders of the lip. Okay? All of them, you can obtain it by impression material. Sometimes during fabrications of the maxillofacial prosthetic, replacements of absence part of the body, sometimes eye, sometimes hand, wrist, ear, nose, all of them can be obtained by taking impression. What type of impression? It's not our matter. The most important one, all of them obtained by impression material. By the definition, what do you mean by dental impression? We have general impression, general parts of the body. We have specifically, we need dental impression. It is a negative replica of the tissue of the oral cavity. Okay? While the cast, it's a positive replica of the oral. This is supposed that this is the impression. It's a negative reproduction into the mouth. While this cast, it's a positive reproductions of the الماوث. مثل الفيلم مع الصورة يقولون عكس، هذا نيجاتيف هذا بوزيتيف، هذا the same part but by the cast. This is the negative reproduction. This is the impression, this is the cast. Okay, when you replace single tooth, you can take impression for single tooth. For this type of impression, we need a special type of the cast. We call it die cast. While when you need to reproduce a full arch, the cast called model or cast. In simple word, if you need to produce reproductions of single teeth, the cast, you can say this is the die. When you reproduce more than one teeth, the cast called model. Okay. This is the model. It is more than one teeth. This is the die. It is single. For every cast model die, we have advantage and disadvantage. The first advantage of cast or model, it provide what provide for you three-dimensional view of oral structure. This is the three-dimensional view. Up, oral, and length. Three-dimensional view. In order to aid in diagnosis, تشخيص and treatment planning. التخطيط. Many restoration or appliances are best constructed on cast. يعني during fabrication of any appliance, suppose that in orthodontic treatment, when your patient it has a habit breaker, it's thumb sucking, يمتص الأصابع. في هيجي حال يريد a special types of appliance we call habit breaker. These types of appliance is best constructed not intraorally. First of all, you must take impression, reproduce the cast in the lab. The technician must reproduce the appliance. After that, return it back to the clinic. Okay. Number two, some appliance or restoration must be constructed in the lab. It is difficult to bring your patient to the laboratory. You can take impression easily in the clinic. After that, the technician in the lab can construct the appliance or restoration, bridge, crown, anything, and etc. After that, return it back to your clinic in order to insertion without need your patient during construction. Number three, models can be used to educate the patient. And you can, by the way, before doing anything in the clinic, you can demonstrate your work to the patient. How? In detail, before preparations of the veneer. You must little bit talk about the procedure to the patient. By what? By the cast. Bring the cast and tell the patient, I will remove little bit from your teeth in the labial side and adjacent area in order to reproduce the restoration in the future unit, in order to educate the patient. And during scaling and polishing, when you have the cast or model, for these times you can demonstrate the way how to brush the patient. It is easily you can demonstrate to the patient in order to brush the teeth. Okay. Number four, this serves as a pre and post treatment record. Okay. What do you mean by it? Before doing any work, you can take impression to the finishing your work. You can take another impression in order to know about the changes that occurred during the treatment. مثل القبل وبعده. Before and after. الصورة قبل الشغل، الصورة الثانية ورا الشغل. شنو الفرق بيناتهم؟ Number five, by using cast, technical work can be passed on the technician, saving valuable clinical time. If you have a cast, you can easily work in the laboratory without need your patient. For this reason, it is save the time for the technician. This is the cast. Ideal, you have some requirements for impression material. Every impression material must have fulfill the following requirement. Number one, every material must have a pleasant taste and odor. Taste and odor. Number two, not toxic or irritant. Must not be some. Adequate shelf life. And must Every impression material must have a long life. Economically acceptable, not too much, not غالي, easy to use, simple during working. Setting characteristics, المواصفات that meet clinical requirements equal to الأشياء أنا أريدها. المواصفات مالها لازم شوية عالي. Satisfactory consistency texture. الديتيل مالها لازم دقيق. Number 8, readily wets oral tissue must be easily wet our oral tissue. Number 9, elastic properties must be elastic, not inelastic. Adequate strength and stability, it must be good. It must be compatible with the cast. Accuracy in clinical use must be good in detail. Number 14, it's the most important one. It's readily disinfected. How some impression material contain the disinfectant material, not need disinfection. Number 15, not release gas or other byproducts. If you release the gas, it means it's not accurate. Classifications of the impression. You have primary impression and final impression. The primary impression, usually you can take it either by the dentist or technician, or by dental assistants. Why? In order to diagnosis for construction of the special tray or appliances, any appliance, or before and after treatment. This is the primary impression. While the final impression must be recorded by the professional dentist. Why? Because we need more accurate. This is the impression. Look here. This is the preparation. Okay. Okay. The classification of impression material. We have several classifications, either by the mode of setting and elasticity. Number 2, by the use in dentistry. Number 3, according to tissue displacement during impression procedure. We have 3 different classifications. Later on, we will talk about it. By the diagram, I will show you. You have rigid impression material, thermoplastic impression material, and elastic impression material. شوف الالاستيك عكس الريجيد impression material. الثيرموبلاستيك impression material هذولا دائما بالتمبريتشر التشينجد. Okay. Do you hear about the rubber impression material, silicone? Do you hear about the agar-agar impression material or alginate impression material? In simple way, easiest way. The first classification, as we talk, based on elasticity. المواصفات مال elasticity. It is subdivided into two types, elastic and rigid material. هذولا rigid يعني معناته شنو معناته؟ non elastic. تمام
دكتور.
تمام. Rigid impression material are those that set to a rigid consistency. It is subdivided into two types, reversible and irreversible. What do you mean by reversible? Reversible impression material. Like what? Like impression compound. It is before you manipulate, before you use the impression compound. It's rigid. After applying in hot water, that means a temperature, it changes to soft. Okay. And before you start, it's rigid material. After you started, you must put in the hot water in order to manipulate. After that, you'll change it to soft. When you remove from the hot water, it will return it back to rigid one. That's why we call reversible material. يعني بالبداية rigid, after during work it is soft, after that it will return it back to rigid properties. That's why we call a reversible or thermoplastic impression material. While a second rigid material we have irreversible. Irreversible شلون؟ بالكيميائي يعني بالتفاعل الكيميائي يشتغل. Zinc oxide impression, zinc ZOE, zinc oxide eugenol, zinc oxide eugenol impression paste or impression plaster. Two examples. Both of them, before you start, it is a rigid material, powder and liquid. After you work, it will change to soft. After setting, it will change it to hard, but not return it back to original shape. That's why we call irreversible impression material. شوف ولا زحمة. If I will bring in the exam in الامتحانات هيجي أجيب لك what do you mean by impression plaster؟ لازم هيجي it is irreversible rigid impression material. It's clear or not? Okay. While elastic impression material من البداية المادة it is elastic. During work هم elastic. But it cannot be returned back. But in both types it is elastic. It is subdivided into two hydrocolloid. If you anywhere heard about hydro, prefix hydro, it means it needs water. Hydro, it means water. Hydrocolloid, it needs water during reaction. Reversible hydrocolloid or irreversible hydrocolloid. Number two, elastometric impression material, like what? Additional silicon, condensation silicon, polyether, polysulfide. Basic mode of the second classification about how to set it. It is thermoplastic, thermoset. A thermoplastic, it is reversible. It will change by the hot water, but after remove the hot water, it returns back to the same shape. While thermoset, it is the same. It is changed by chemical reaction, not returned back to original shape. That's why we call reversible. The most accurate impression material, it is, look at here, polysulfide, polyether, silicon. This is the most accurate impression material. The best one. According another classification, according to use in dentistry, either for complete denture in prosthesis, or impression for dentulous mouth, for partial denture, removable partial denture. And the third classification, either for complete edentulous patient or partial dentulous patient. Another classification you have according to tissue displacement. الضغط مال الامبريشن السوفت تيشو ايش جيت ميكوستاتيك it produce little bit displacement like plaster ZOI low viscosity alginate low viscosity elastometric material, while compressive from its name it produce more tissue displacement like impression compound and high alginate elastometric impression material. This is the impression tray. What do you mean by impression tray? It is a container to carry the impression material. مثل القلابة. انتم تعرفون القلابة شنو صح؟ In order to carry the material from anywhere to another location. You have stock tray, special tray. Any impression material must have the following properties. Number one, carry the impression. Number two, hold the material in close proximity to the teeth. Number three, avoid breaking during removal. Must not be easily displaced. Prevent warping of the complete impression. And must not be tear easily, break down, and etc. This is the examples of the impression. This is the full arch impression. It's a sectional impression. This is the quadrant impression. This is the rubber ball impression, spatula, marker, water, powder. This is the alginate impression material.